Hello everybody, my name is Ulrich Sure. I'm the professor of neurosurgery of the University Hospital in Essen, Germany, and it is one of my distinct research and clinical topics to take care of patients suffering from cavernous malformations. The surgical techniques for cavernomas are internationally very similar. We use microsurgical techniques. The technique as such is maybe not so important. What is really important is to consider which particular approach should be used to remove a cavernoma, and for that somebody needs a very broad experience with as much as possible cases or patients. A cavernoma should only be treated when it is symptomatic, and usually it becomes symptomatic when it has bled. It should be treated when the risk of treatment is counterbalanced with the risk of a new bleeding and maybe new neurological deficit. A very important thing is to counsel an individual patient for the risk and also to help the patient understand that cavernoma is not very bad disease and usually does not lead due to, for example, devastating hemorrhage that brings death to the patient. Thank you. The treatment indication is furthermore given by the age of the patient, because the age of the patient, of course, gives also the quantity of possible future hemorrhages. 80-year-old patient most likely will bleed less frequently than a 10-year-old patient. And then there are other things like if the patient, for example, has some comorbidities, or if the patient is suffering from multiple cavernomas. In the latter case, usually we should be very restricted to offer a treatment for them. I believe that cavernomas should either be treated by surgery or they should be left in peace. Don't do irradiation, and unfortunately also so far there is no medical treatment, meaning drug treatment for cavernomas. However, I think within the coming years there will be new opportunities with new drugs, but in summary, once again, if a treatment, then only surgery. The localization of a cavernoma is of high importance for the patient when it has bled, particularly those that are localized in a so-called deep localization. This is meant brainstem, basal ganglia, thalamus, and the so-called insula. These cavernomas have a definitely much higher risk for bleeding and neurological deficit. And therefore, these patients usually should be treated a bit more aggressively than other patients. One more thing that is really important is epilepsy. If a cavernoma causes epilepsy, then this is also a very strong indication for surgical treatment of the cavernoma.